Hi friends. Welcome to Dentistry Love channel. Lower tooth extraction and forceps used. Synopsis. Periosteal elevator. Lower anterior forceps. Lower root forceps. Lower premolar forceps. Lower molar forceps. Lower COWHORN forceps. COUPLAND'S elevator. CRYER'S elevator. Periosteal elevator. It is used for all teeth and it's the first instrument we use in extraction. It is used to relieve the attachment of gingiva to the tooth. If the tooth structure is less, we have to lift the mucoperiosteum more deeper, followed by the engagement of teeth with forceps can be done at the cemento-enamel junction. If the tooth structure is less, engage it deeper. Lower anterior forceps. It's right-angled. Here the beak is little curved designed to hold the curvature of the lower anteriors. For lower anteriors extraction, it's single-rooted and we can go with apical pressure, buccal traction followed by palatal traction and then rotation. Lower root forceps, it is right-angled. Here the beak is slightly flat designed to hold the curvature of the lower root stumps as well as to remove the broken single root of the multi-rooted tooth. For lower root stumps extraction and if it is single-rooted and we can go with apical pressure, buccal traction followed by palatal traction and then rotation. Lower molar forceps. It is right-angled and the beaks have sharp tip in mid, which engages in furcation area, to hold in between mesiobuccal and distobuccal roots. For extraction, first apical pressure then buccal traction followed by lingual traction. Lower COWHORN forceps. It is right-angled and here the beaks are sharp, looking like cowhorn and this is why it is said to be cowhorn forceps. Two sharp beaks are used to hold the furcation area, on both buccal and lingual side. For extraction, first apical pressure then buccal traction followed by lingual traction can be given. COUPLAND'S elevator. It is of three types with varying thickness. Used for luxating the teeth prior to forceps application. Blade has concave surface on the side which faces the tooth. Sometimes the blade can be at an angle to the shank. It is placed parallel to the long axis of the roots between the socket walls and the roots and worked towards the apex. Lever and wedge principle is employed as well as rotational movement. Used for luxating the firm as well as grossly decayed tooth. CRYER'S elevator. It is of two types, right and left. Right side has the convexity and tip facing towards left. Left side has the convexity and tip facing towards right. It has a triangular blade. Working tip is angulated with one convex and another flat surface. Convex surfaces faces the root to be removed. Used in cases when any root of a multi-rooted teeth is left in its alveolar socket. It is placed in the adjacent root empty socket and rotated to fracture the interdental septum and push the root remnant from its socket base. It can be used for both upper and lower teeth. Here, the wheel and axle principle is employed. Thank you friends. Please do subscribe for more videos.